I don't know if this will be a 5-minute type of question or if we'll have to continue this conversation further, but I have a question about the PA rural health model. Correct me if I'm wrong, I believe that initiative was to begin this year in terms of global budgeting and kind of giving our rural, I represent a very rural area. Could you maybe talk about where we're at with that process and what our goal is in terms of our funding and our reimbursement for our rural hospitals?
Absolutely. So I'm very pleased to talk about our rural health model and the rural health program. So as you said, that program has started. It started in January with 5 hospitals that are going to be announced in the next week or two, actually, with involving all the major payers in Pennsylvania. So this is involves a transformation plan for those hospitals where instead of acting under a fee-for-service mechanism where you have to fill beds, they're going to be working under a global budget with the major insurers so that they can focus on population health and improving the health of the community. They don't have to worry that they have to have patients in the hospital. And so they can focus on inpatient, but primarily on outpatient services to improve the health of their whole community. The next step is that we'll work with the legislature to establish the Rural Health Redesign Center. That center would take over the functions that the Department of Health has been doing. The Secretary of Health, the Secretary of Human Services, and the Commissioner of Insurance would have seats on that board, but then the payers and the providers would also have seats on that board. And so we are looking for legislation for that. That passed unanimously in the Senate in the fall. Because of the election, it didn't quite make it through the House, but we're looking forward to that this year. In January of 2020, we will have 18 hospitals in Pennsylvania as part of that model. And in January of 2021, the goal is 30 hospitals. The funding, there is no state funding required for this. The funding, initial startup funding, is coming from a grant from the Center for Medicare and Medicaid Services, part of CMS. And then that Rural Health Redesign Center will be able to get foundation money, be able to get consultation fees, et cetera, and would be self-funding.
And when did you say the goal for the 30 hospitals would be?
In January 2021.
21, okay.
So we're very excited that the rural health model has started, and we're looking forward to working with you all on the Rural Health Redesign Center and to really work to save rural hospitals in Pennsylvania, which is so critical for access to medical care as well as jobs, because many of those hospitals are the primary employers for those areas.
I remember the first time this was brought up to me was a hospital administrator for the Fulton County Medical Center, which I know there's been some staff members that have been to Fulton County and some of my former colleagues, and Ms. Mulchaney. It's a fantastic area, and you know, I encourage you to get down to see what is being done there, and I'm excited about this opportunity. I mean, you know, those of us who are not from the hospital or healthcare background, we're looking for any information that we can get. I assume the hospitals, whether it be the Hospital Association, other stakeholder groups, the insurers have been brought in and
absolutely
have discussed this. What are the thoughts from the different areas
so HAP
in delivery?
is enthusiastically supportive because it saves rural hospitals in Pennsylvania. The insurance commissioner has been at the table. The Department of Human Services secretary has been at the table. We have all of our major insurers currently participating. We're working with some of the other insurers to get them on board. And so actually this is a win, 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 and win. I mean, nobody loses with this, and it costs no state money.
All right, perfect. Thank you very much.